Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Welcome to Fairhope Hospice Today. My name is Kristin, I'm President and CEO with Fairhope Hospice and Palliative Care, and it's great to be here today at the Pickering House in the Family Lounge. I am gathered with some of my palliative nurse practitioners, and we are here today to talk with you a little bit about what palliative means, what the palliative program does, and to give you a chance to just meet our nurse practitioners. So I'm going to hi ladies.
Hello.
Good morning. I'm going to go ahead and turn this over to you for a second. Introduce yourself. Will you tell us a little bit about how long you've been here with Fairhope?
My name is Kristina Seymour Harley, and I'm a nurse practitioner here with Fairhope, and I've been here just a little over 3 years.
My name's Alicia Grillo. I'm a nurse practitioner here with Fairhope, and I have been here for almost 6 years now.
My name's Haley Worthman. I'm a nurse practitioner here as well, and I've been here going on a year.
Well, thank you guys for taking some time out of your busy schedule to meet with me today. We just finished one of our important team meetings that we do every couple of weeks, and so I snagged them to come in, and we're going to talk just a little bit about what you do and how you help the community. You know, Alicia, you and I have been together in this for quite a while. Mm-hmm. And palliative program, I think palliative sometimes is a little bit confusing for everybody, for the community, for physicians. But you know, when we started this palliative program, it looked very different than it did now.
Oh, it sure did.
And that was a lot of years ago. I mean, palliative has been around in Fairhope for many, many years, but we've just transitioned probably over the last 4 years to move towards a nurse practitioner driven care. So can you talk about just a little bit about how the palliative program has evolved?
So initially when the program was developed, we were created to have nursing visits in our community so that they can have a little extra support in symptom management. And that's really what palliative care is about, is taking individuals who have chronic health problems and working towards managing the symptoms that are associated with those medical problems. So while there are other physicians and specialists and healthcare providers are working with the disease process itself, we're working on the backside to help increase the quality of life and manage those symptoms and allow people to be where they are supposed to be in the most comfortable setting possible. Mm-hmm. So this has evolved in the past 5 years with the addition of nurse practitioners, as we can go in and make those changes ourselves right at the bedside and take the advanced assessment techniques that we have been taught to really hone in on what the needs are of the needs of our patients and communities are. Mm-hmm.
So, you know, when we think about what that looks like now and where we came from, you know, I just think that we're very fortunate that we've been able to progress and move towards you as providers and nurse practitioners and specialists in your field. Not only are you reaching out and helping so many patients in the community, but think about the physicians. Can we talk a little bit about what your role is with the physicians in the community and really how you think that you've helped them through with a lot of their patients?
So I think a main perk of having our palliative care program is we visit people in their comfortable setting of their home or wherever they're most comfortable, whether it's an assisted living facility, a nursing facility, or their home. And that allows us a chance to get a glimpse into the life of their day-to-day activities. Mm-hmm. And we are able to take the time to talk about what the most important things are for that individual. And sometimes it's as life altering as reading the Bible and eating mashed potatoes, and that's the most important thing for that day. And you don't often get that glimpse in an office visit where your time is managed so closely with visits after visits after visits, and we get the chance to see what really makes a person tick.
That was the one thing that I love about the program that you said is the physicians do such a great job of managing their patients' care, but you guys really get that extra, special, slowed down version of where they are and what they need. And I think that's the best question, and we ask that with hospice patients too. What's most important to you? And sometimes that's all it takes is really just to open those floodgates of, well, my family wants this for me, but this is what's most important to me. So do you feel like sometimes you run into struggles with what the patient wants, what the family wants, and maybe even what the primary care physician wants?
Oh, absolutely. Yeah. Do you want to talk a little bit about that?
Well, yeah, that can be absolutely a challenging dynamic that sometimes we're just able to help facilitate, whether it be the communication between collaborating with their providers and making sure that the providers are informed of what the patients and or the families want, or maybe it's on a more personal level of there's challenging dynamics between the family members and the patient themselves, so we can always utilize some of our other resources like our social workers, ourselves included. We have chaplains available to our patients that can help kind of bridge that gap and maybe start mending those bonds.
Yeah, I love that you talk about that because I think we're very fortunate that we have such a great social work team, chaplain team, we have volunteers, and people think, well, you already provide those with hospice, but what's different and how can you provide that with palliative? But something that, I kind of wanted to talk about too so that our listeners understand is when you really talk about the difference between palliative and hospice. When you're meeting with a family, let's say at the hospital, because for those of you that are listening and watching that maybe don't know, our nurse practitioners are at Fairfield Medical Center 5 days a week. And you see a lot of patients. The physicians will come to you and say, I need you to have this conversation, this difficult conversation with this family and with this patient. So, that's a big part of your practice and what you do is helping them with those conversations. So when you are meeting with the families, how do you explain the difference then between what palliative is and what hospice is?
Do you want to take that one, Christina?
Well, palliative care is for anyone with a chronic condition. It can be anywhere in that trajectory of that condition and that diagnosis. Where hospice focuses more on the last 6 months involved with that condition. With palliative care, it does not interrupt any of your other specialists. It does not change your primary care provider. We are just an adjunct, kind of like to say an extra blanket of coverage to help you navigate the system, navigate all of your specialists, navigate the community resources that are available to you. And as she had mentioned before about the ability to go into the home, I think that's very helpful as well because we get to see that whole picture and help that family and the patient navigate that palliative condition.
I think something that's interesting that you guys talk a lot about, you get to go into the home and you see everything that, you see that they maybe haven't eaten, there's nothing in the fridge, you see what their condition of living is. But when they go to the doctor, they're well kept, they look fine, they tell the doctor, we're fine, we don't need any assistance. But when you go, you see things differently. Then do you report that back to the physician sometimes? So they're aware of maybe where there might be a deficit.
Yes, absolutely. I think we have a different vantage point because we are coming into the home, which in and of itself, we're able to bridge a gap for a lot of our patients. I've had patients who their primary care doctor discharges them from their services because they can't physically get out of their home and go into the office.
Good point.
So it's hard when you have chronic illnesses and sometimes multiple of them to get out and to go to all those specialists, to get out and go to all those doctor's appointments. It's like a full-time job. So we're able to help bridge a gap, make sure the patients are getting the care they need because we come to them. But we do get that different vantage point, and where the primary care doctors or the other specialists aren't going in their home, seeing their environment, maybe being able to make recommendations on, hey, this would be a safer option for you. Hey, maybe we could modify how we're doing these things in the home to keep them feeling better, to keep them safer, to keep them in their home longer than just seeing them in and out of a 10-minute, 15-minute office visit.
Yeah.
So how...
I would say, and we really coordinate with that primary care provider. They get a copy of our notes after we see the patient. We keep that lines of communication open. And because we develop relationships with the primary care providers in the area, it's really a vantage point for the patients, so they can get things quicker, get their symptoms resolved quicker.
It keeps them out of the hospital.
Yes.
The patients build trust with you. You build the trust with the physicians. And so I think that's really a great partnership that you guys have worked so hard to create. So I have so many questions and I work with you every day and I understand it, but there's so many things to think about when it comes to palliative care. So if you have questions about palliative care, and oftentimes people will call in and say, I don't know what I need. Do I need palliative?
Right.
Do I need hospice? Don't worry about that. Make one phone call. That phone number to call is 740-654-7077. Just simply call in and say, I have questions. I'm just not sure what I need. I'm not sure where I am or my spouse is or loved one in their condition or their diagnosis, and I just need some guidance. So we have a really great team that when you call, they can hear what the family is telling them, where they are in their trajectory of their illness, and then that triage person can kind of move them in the right direction. So we're very thankful for them, and all you need to do is give us one call, and we'll be right back. It is so important for families to feel comfortable and safe when they call, because oftentimes that first phone call, even picking up the phone physically and just dialing that number, is very hard. You're asking for something that is a very difficult and private decision, and so we want everyone to feel comfortable and safe that you pick up that phone, you make that phone call, and let us just guide you and lead you where you want. And then you can make an informed decision about what's best for you and your family.
Where can I find advanced heart care?
When you choose Fairfield Medical Center for your heart care, you'll find confidence in our expertise and peace of mind in our compassion. Your health is important, and our heart and vascular experts specialize in the latest technology and treatments to keep you feeling your best. Whatever you're searching for, you can find it at Fairfield Medical Center. You walked down the aisle and promised happily ever after. Sometimes happily ever after means ending a relationship. We know the conversations are not easy. Deciding what's best for you, your children, and your next steps takes work and communication. At Dagger Law, we know there are no monsters in a divorce, only people trying to find their way. Local, trusted, experienced. Dagger Law.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
My name is Allie. I just became 14 years sober at the end of last month. Through the support of my family and friends, I got the courage to ask for help. And through treatment services and the recovery community, I was able to start my recovery journey. Now I get to work as a peer supporter and an addiction treatment navigator, where I get to help the next sick and suffering. If you don't have family and friends that can support you right now, you can find those supports through treatment providers, the recovery community, and peer supporters like me. Every life matters, and your recovery is worth it.
This message is brought to you by the Fairfield County Adam H. Board.
What makes Fairhope what it is our staff. It's always a question that we ask, why do you want to be here with us? And what they most always say is, you've touched my life this way. You took care of this person, or I've seen what you've done and I want to do that. And so the staff that have been here know what it takes. They've been on the other side. They see what it takes to make someone comfortable, to make the family comfortable, and really what kind of support they need. And so I think that's what really makes Fairhope what it is. Welcome back to Fairhope Hospice Today. Thank you for joining us today. I am here with Fairhope Hospice and Palliative Care nurse practitioners. We're discussing today all the information that you need to know about palliative care, and really it's just such a wonderful program. It's growing leaps and bounds. You know, when you and I were started this together, you know, we were when we hit 100, we kind of did a cheer. Yeah. Now today we're pretty close to close to 300 patients. 300. Mm-hmm. That's pretty incredible when you think about it. So I know that you all work so hard and you're such good partners with Fairfield Medical Center. That's a lot of patients to see in the community and serve their needs and just try to make sure that they're getting what they're needing. You know, I think an important piece of palliative care is helping to keep those patients out of the hospital. Mm-hmm. By having your interventions and their primary care's interventions. You know, the goal, I think, is that they're comfortable, that chronic illness is managed, and we can keep them out of the hospital.
Yeah. Mm-hmm. So, absolutely.
I think, you know, there's something that I think is interesting that I've found over the years that I've been working with you guys. You get a referral for palliative for someone who has a chronic illness. Maybe that illness is on the early stages, like you talked about earlier. You know, they could have anywhere up to maybe 2 years, you know, of a chronic illness, and they're at that point where maybe they have a 2-year life expectancy. Some are longer, some are shorter. But I think sometimes what you see, you get these calls for these very ill patients. And when you look at them, you think, wow, they could really benefit from our hospice services and just the comfort care and everything that hospice provides. But when you talk to them about that, they're not ready. So what do you see when you go into a home and you know in your heart someone could really be ready for hospice physically? What happens when they're not interested?
By all means.
Well, that certainly happens, and maybe more frequently than not. I think that palliative care being introduced early on is always more helpful than not. And sometimes, well, I guess more times than not, we're finding that palliative care is kind of being consulted when kind of late in the game. Like, we really could have been an appropriate resource for this person, you know, months and months, if not years ago. Mm-hmm. But regardless of that, we're able to build rapport. We're able to really sit down and have those tough conversations and get a feel for what the patient's goals are, because I'm not here to push any agenda. I am here to be honest and to give my professional assessment and opinion of what options we're looking at and where we can go from here. But ultimately, my patient's there to lead the ship, and I'm going to help them do that. So sometimes their body may be appropriate for those more comfort measures. There's certain things that qualify our patients for a hospice kind of service, but their heart and their mind might not always align with that, and that's okay. Mm-hmm. I want to be there to support them throughout that. We have continued discussions, and I think just getting to develop a relationship with those people, family, patients on a more personal level than quick in-office visits and you're seeing them for 15 minutes or so, and then again in another 6 months. I think that it allows that patients to develop some trust, mm-hmm. the families to do the same, and with time, if it's within their goals, then we can help make that soft transition into those comfort measures if and when they're ready for it. But we're along the ride to help lead them however they want to be led.
That's important that you say. We keep coming back to the word trust, and I think that's so important because they trust their physicians. Mm-hmm. So when you guys step in and you start to see them, you're building that relationship, whether you see them once every 4 weeks, 6 weeks, 8 weeks,
yeah.
You're building that trust with them. And you know, I think the ultimate goal is if they're on board, if they feel comfortable, you know, we want to have sort of a gentle handoff from palliative services to hospice, because it is a very personal decision. Oftentimes our palliative, patients don't sign on to hospice, and that's okay. We'll talk about some statistics. So you have about 280 patients on service. We have an average of maybe anywhere from 30 to 40, and 40 is a high number of patients who transition from palliative care to hospice care a month. When you and I first started doing this, we had maybe 5 a month that transition. So for me, that says the trust is building, you're reaching more people, the physicians are understanding, and that trust is being built. So for that, I'm really thankful for what you offer the community.
And ultimately that will come back down to what is the most important thing for those individuals we're caring for. And having the ability to build the relationships. It comes to mind for one that does touch my heart very recently. The person had a very slow progressing condition, and most of the time when we would visit, it always ended in a joke and a laugh and a chuckle and a little pat on the head for their cat. But as the last few months have come around, the jovial attitude was not there anymore. And the last visit that I made eye contact with the person that we're caring for, and he looked at me and said, "I think it's time." And I said, "I think it is too." And that was a really beautiful moment, because that was the moment of acceptance and feeling philosophically ready to transition to that next phase in life. And I don't know that that moment would have happened had it been in an exam room sitting on a crinkly piece of paper. It was in the home with his kitty cat sitting on his lap and in the right place where he should be.
Absolutely.
And it's those moments that also help to fuel us, knowing that we're doing good work in the community to allow that to continue to happen.
Yeah, well said, well said. So if you need information on palliative or hospice care, please call 740-654-7077. You can go on our Facebook page. You can go to fairhopehospice.org. You have all the information on there that you need. You can make one phone call. That's all you need to do. Let us do all the other work. We can notify the physician. We can get it, whatever you need to help get you the information that you need about palliative. So I wanted to talk a little bit, just for a few minutes, about actually some questions that come up. So, you know, there's been so many different discussions about, well, what's palliative and what's hospice? And so we kind of came up with this fancy little card, and it talks a lot about, it's got questions on there that have come from patients and providers and nurses. And so I thought we would kind of talk a little bit about what these questions are, and I'm going to quiz you guys for the answers. Ready?
Okay.
All right.
We pass.
So when we talk about palliative, who can be treated? Who can be treated for palliative care?
Anyone with a chronic condition.
Perfect.
That needs symptom management.
Perfect. So there's a lot of questions oftentimes about symptoms. You know, someone says, well, you know, I'm not ready for hospice, I don't want hospice, but I'll take palliative. So are my symptoms going to be relieved? How do you help patients with their symptoms?
So it's certainly based on the condition and their goals and what we're working with as far as medical diagnoses. But common things that we would look for is treatment of pain being one of the most common. However, we do see a large symptom burden with shortness of breath, or feeling anxious or restless, unsure of what the future is, sleepless nights, poor appetite. Working with more than just the most common causes of complaints to a medical provider, but trying to incorporate all of that in the day-to-day activities. And is it something just as simple as placing a fan on the table to help circulate that air to relieve some shortness of breath? Sometimes it's not always a medication that we utilize. Sometimes it's something as simple as modifying the day-to-day activities.
Do you think, but do you guys feel that one of the best parts of your job, and when you make a visit, are finding these things? So someone has all these different symptoms. I can't sleep, I'm having some trouble breathing, I just feel a little anxious or short of wind. So you look at the whole picture, knowing their chronic illness, knowing what some of these symptoms are. That's how you tie that together, right? You know, you just kind of pull all those things together, where maybe they have 15, 20 minutes with their primary care physician and he says, well, I'm not sleeping well, but they forgot to tell them all these other things. All right, you see that a lot?
They forgot to tell them that they're not sleeping well because they can't breathe when they lay down.
Okay.
And there might be something that we can alter, like adding extra pillows, or something to that effect that will help relieve those symptoms.
Nice, very good. So what about patients and families that ask you, I have a cancer diagnosis, I'm not ready for hospice, I'm not appropriate physically, but can I still continue my treatments, curative treatments on palliative care?
Absolutely.
Yeah.
Okay.
Absolutely.
You can continue any care that you already had in place. We're just an extra layer of support. All the other specialists stay involved and a part of the care.
Okay, and that also includes their primary care physician.
Yes,
So
absolutely.
those who have trusted and seen their primary care physician for 20 years, they don't want to all of a sudden hand things over to you because they've built that. So seeing their primary care physician is perfect.
Absolutely.
To continue. Okay.
And sometimes we even add in some extra. So if we go to a home and we notice that a person may have had some falls and they're lacking strength and mobility, we may refer to a home health provider who will help us as part of the team with physical therapy for a short period of time until that person regains that strength. So it doesn't take away any aspect of care. Sometimes we even add a little extra.
Great. And then to add our social workers, chaplains on top of that to help them with some of the things that you referred to earlier about transportation, meals, finances, living will, power of attorney, those things.
Yep.
That's important. That a lot of times can ease some anxiety when a patient has feelings of concern about those social determinants that they're lacking.
Absolutely.
Okay. Let's talk about who pays for palliative. Okay, so I'll start, you guys jump in, but when you think about going to see a physician, a specialist, a cardiologist, a kidney physician, those are specialists. To me, you guys are the specialist in palliative care. So when you see a cardiologist, they're going to bill the insurance for that specialist visit. We're going to do the same thing for your visits.
Correct.
Right? So understand that you may see a copay or something that comes from your insurance. So when the nurse practitioner makes a visit to see you at the hospital or to see you in your home or facility, whatever that looks like, you may see a copay for that. What we want you to understand is that nobody ever will be turned away for service from Fairhope and Palliative Care due to their inability to pay. We have lots of safeguards, lots of things that we can kind of help you through that if finances are a concern. So we want to be clear that there are rules and regulations. We have to bill for your services. You're professionals, and we know that. So there may be a copay that you see. If that's ever a hardship for you, we want you to notify us here. There's a billing number on our webpage, which is fairhopehospice.org. You can call in here at 740-654-7077. Ask for billing, and we can help you through all those, anything that might be concerning to you. Okay. Well, anything else you would like to share today? Thank you so much for your time. I know I had to kind of drag them away from their day's work, so thank you.
Yes.
Absolutely. It was a pleasure.
Okay, guys, thank you for everything that you do. You're just a blessing to Fairhope and to the community.
Thank you so much.
Thank you.
You're welcome. I want to share a little surprise. All right, so save the date, mark your calendars. Go to our Fairhope website page, our Facebook page, but our signature event, Fairhope Celebrates Life, has been scheduled. It's for Thursday, April 6th. We would love to see everybody there. If you want to donate an item, if you'd like to be a part of that, you can purchase a ticket. We are going to actually have it this year live at the Lancaster Golf Club, but you can also, so you can get dressed up and go enjoy the evening out, have some hors d'oeuvres and drinks, or you can sit at home on your couch with your comfy PJs and bid away on some of the incredible auction items. So if you have any questions or you'd like to be a part of that, please give us a call here at 740-654-7077. Thank you for watching. See you next time.
Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.